we're back here at Encompass Health, and now we'll be talking with two of the therapists who've been here since the facility opened, Megan and Caitlin. Welcome.
Thank you so much.
Appreciate it.
Tell us a little bit about your role and how you help patients.
Sure. So at Encompass, I'm the senior physical therapist. So I oversee the physical therapist here, and then we work individually with patients each day to help them with things like walking and transfers and getting back to their normal everyday function.
And my name's Megan. I'm the lead occupational therapist. I work with the occupational therapy team, and we function working on things that are functional, like baking or cooking, dressing, any type of activity you would do in your home. We're going to try and get them back to doing that independently.
Right, obviously, because that's so important. The goal is to get them back to home life and able to live day-to-day activities. So very important.
Yep.
What are some of the ways that set Encompass apart from other inpatient facilities?
Sure. So at Encompass, we really like to individualize our plans of cares to each patient. So whatever their interests are that they can do to get themselves home, those are things we want to focus on. For some people that might be cooking and cleaning, like Megan said. For some people that might be getting back to their leisure activities like walking the dog or playing golf or whatever that might be. So those are the things that we want to work on to help get them back to their goals. And so we'll come up with an individualized plan for each patient to accomplish those things.
Give us an idea of maybe an average length of stay for a patient and based on what situation they might be in for.
Right, so it's entirely independent based on the patient, their diagnosis, and a lot of other factors, but the average length of stay is between 10 to 14 days. And we're just gonna hit the ground running when they get in here because we wanna maximize the amount of time that they have here and give them as good and quality of therapy that we can in order to get them as independent. We're gonna keep saying that over and over because that's our goal, and that's their goal too, is to get them independently, exactly, to get home, yep.
Well, obviously Encompass has invested a lot of resource and time into special equipment. Why don't we take a look at some things?
Sure.
Show us what's here.
So this is a balance system that we can use.
Maybe step up there, okay.
So one of the nice things about this is we can do some formalized assessments to see how someone measures up to someone their age if they're at an increased fall risk, because that's obviously a reason that a lot of people end up in a hospital. So for this one, you would be kind of shifting your weight to step forward a little bit for me and space your feet out. There you go. And so now you're trying to shift your body weight to try and hit that new target.
The red. I went past. Okay. Oh, there we go.
And then come back. There you go. Good. And forward. And so as someone got used to doing these type of exercises, we could make it harder by having the platform move to work on things like being able to walk on a golf course or at the beach or even in their yard to get the mail. So those are some things that we can work on with this balance system.
And earlier we were playing around and you moved it, and it's very tough for someone who doesn't have a challenge at the moment. So it's not an easy thing. So this is really great.
And that's something that we see as people age, is that their balance systems continue to decrease, and so they're not as reactive when they have falls. So that's something we want to work on to prevent falls.
And in our area there is an elderly population, and that's a common problem. That we have here.
Absolutely.
We're going to take a look and check out another piece of equipment.
Yes, absolutely.
So this is another piece of equipment that we have at our leisure to use with our patients. This is called the BITS machine, and we have a lot of different avenues that we can use the machine with. A lot of it has to do with visual scanning or oculomotor control. And then we also have some assessments down here that we can use for quantitative information in order to track how a patient's doing during their stay. But I'm gonna let you try out a couple of them. So this is trail making. And a lot of times we forget how much we use our eyes in everyday activities, and we need to be able to scan across an environment to see what's around us, be aware of what's going on around us. But with this whole screen, it's all touch capability. There's entirely touch capability. So you can start on the green dot, and what we want the patient to do is to connect 1 to 2, 2 to 3.
Like dot to dot, like when you're a young child?
Yes. So we do this so much when we're kids, and then when we're adults, we lose those types of skills that we need. So I'm gonna have you start at number 1, and then hold your finger down and go all the way to 2. And you'll hear this bubble popping sound. That means you're doing it correctly. If you were to go to 6 next.
Let's try that.
It's gonna tell you no. So you get that auditory feedback.
Oh, wow.
But yeah, the goal of course is to go from green to red. And then once you're done, we're gonna quit the program. it'll end up giving you this quantitative report of how long it took you to do it. It'll tell you how many misses you had, and then we can use that going forward to kind of customize our treatments for the patients.
Yeah, neat stuff, fun, and neat stuff too. How do you keep the patients motivated if they get discouraged, down?
Sure. I think like we talked about earlier, one of the big things is just going back to things that they enjoy. And so like I've had a patient in the past that wanted to get back to horseback riding, and so we got out a bolster and practiced getting on and off the horse. And I'm sure Megan has some examples too.
Absolutely. So handwriting is a big thing with the elderly population, that sometimes their fine motor starts to decrease. So we want to hone back in on those skills and maybe provide some adaptive equipment in order for them to be able to write again. If one thing doesn't work, then we go to plan B, C, D, and we always want to keep it changing and engage the patient as much as possible. So
yes. And we certainly sometimes utilize loved ones. If their spouse knows something in particular that they enjoy, then we can certainly use that as incentive and motivation too. We also have facilities where if they have a dog or a cat or something that they're wanting to come visit, they can have that to help incentivize and motivate them too. So that's a nice part about this facility. Yeah, make it feel a little bit more like home, exactly.
Yeah, well, we've enjoyed trying out your equipment here and hearing how you help patients and so forth. So you don't want to miss it. We've got one more segment coming up here from Encompass Health.